This is Sam here. Today we'll be discussing about diuretics on pharmacology. First of all, what are diuretics and for what they are used? These are water pills which causes increased in urination or increased diuresis. For what we need to cause urination from a human body in order to decrease sodium or potassium retention, which is used to treat hypertension, and also abnormal accumulation of fluid in body, which is also known as edema. These characters or these conditions can be reduced by using these water pills, which are diuretics. Now let's move on to the mechanism of action. This mechanism of action is based on the part where they act. This occurs in kidney, where nephron is the structural and functional unit of kidney. Here, this occurs in 5 distinct regions of nephron. First, it's Bowman's capsule. What is Bowman's capsule? What it consists of? Bowman's capsule is surrounded by capillaries which are called as glomerulus. That is why this filtration is known as glomerular filtration. Now, what happens in this Bowman's capsule? The blood to be filtered, which is carried through afferent arterioles, enters to the capillaries, which are glomerulus, and they get filtered in the capillaries, and the filtered blood moves away from the capillaries through afferent arterioles, and the filtered content is known as glomerular filtrate, which moves on to the capsule, enters the Bowman's capsule. This glomerular filtrate, what is glomerular filtrate or what it consists of? It consists of water, amino acids, glucose, sodium bicarbonate, and electrolytes. This glomerular filtrate further moves to the second process or second part of nephron, which is proximal convoluted tubule. What occurs in proximal convoluted tubule? These components of glomerular filtrate are partially absorbed or rather completely absorbed in some contents, like 100% of amino acids are absorbed, 90% of sodium bicarbonate is absorbed, 65% of sodium, potassium and water is absorbed. In this condition, wherever sodium goes, water and chloride follows it. Now, next to the proximal convoluted tubule, this glomerular filtrate moves on to the descending and ascending loop of Henle. First of all, what occurs in descending loop of Henle? In descending loop of Henle, it is permeable to water and impermeable to sodium. So, as a result of impermeability to sodium, sodium stays, which causes passing of water. And same way, in ascending loop of Henle, it is permeable to sodium and impermeable to water. So, there occurs 25% of sodium gets reabsorbed. Now, the fourth part of nephron, which is distal convoluted tubule. In this, 5 to 10% of sodium chloride gets reabsorbed, which in turn causes more dilation of this or more diluted form of this glomerular filtrate. Now, the fifth part, which is late distal tubule and collecting duct. This is the final part or final process where occurs in this nephron. It is classified into principal and intercalated cells found in this late distal tubule and collecting duct. In this, first comes, there are two hormones in principal cells, which are aldosterone and ADH. These are the two hormones, aldosterone and antidiuretic hormone. What is the function of aldosterone? It causes increase in sodium reabsorption and potassium secretion. And ADH, which is antidiuretic hormone, causes increase in H2O, which is water permeability and reabsorption. At last, the intercalated cells, the function of them is to secrete hydrogen ion and reabsorb potassium. This is the basic function or mechanism which takes place in the part of nephron. In later we will be discussing which part of drugs which are used to treat in each part of this nephron which causes decrease in hypertension or decrease in water accumulation in the body or fluid accumulation in body, which is known as edema. Friends, priorly we were discussing about the mechanism and what happens in nephron. Now let's move on to the mechanism of action of drugs. Based on their mechanism, they are classified into 5 types: carbonic anhydrase inhibitors, loop diuretics, thiazide diuretics, potassium sparing and osmotic diuretics. First, carbonic anhydrase inhibitors. What is their action and where are they found? Now, their location is proximal convoluted tubule and their function is to decrease reabsorption of sodium bicarbonate. by, as per their name, inhibition of carbonic anhydrase. Where it occurs, in order to know more detail, let's zoom into the epithelial cells. What happens in this epithelial cells? Imagine this as the lumen and this as the interstitium of blood. With the exchanger of sodium and hydrogen, the external sodium enters into the cell and internal hydrogen goes out. Over here, simultaneously, as a result of sodium potassium ATPase pump, sodium goes out and potassium enters into it. Now, this hydrogen ion, which is present in the lumen, combines with the bicarbonate ion to form carbonic acid. This carbonic acid then gets dehydrated rapidly with the help of enzyme called carbonic anhydrase to form water and carbon dioxide. With simple diffusion, this carbon dioxide enters into the cell. This carbon dioxide, again with the help of enzyme carbonic anhydrase, forms carbonic acid, which diffuses into hydrogen and bicarbonate ion. In order to reduce this mechanism, here comes carbonic anhydrase inhibitors, which inhibits carbonic anhydrase in these two places, which in turn decreases sodium in the cell and increases sodium externally. This is the main cause of carbonic anhydrase inhibitors, increase in sodium. And the second is metabolic acidosis due to bicarbonate, as it is a major component of acid-base buffering system. Now, example of this carbonic anhydrase inhibitors. The example is acetazolamide. This has a side effect of xerostomia and dizziness. These have mild effect as they increase the sodium level. They cause mild diuretics or known as mild diuretics. Now, let's move on to loop diuretics. These are also known as high causing diuretics or high action of diuretics. Now, same way, this is the epithelial of cell. The main function of this is to inhibition of sodium potassium 2 chloride co-transporter. The location of it is loop of Henle, mainly in the ascending limb of loop of Henle. As we know, there are two limbs, ascending and descending limb. Over here, the action occurs mainly in the ascending limb of loop of Henle. Now, let's zoom into the structure of the epithelial cells. Over here, this is the sodium, potassium and 2 chloride transporter. So, the main work is to inhibition of sodium potassium 2 chloride co-transporter. So, this occurs at last where this occurs potassium ATPase pump, sodium and potassium ATPase pump, where sodium goes out and potassium enters in. Over here, the potassium interstitially comes out. The coming out of potassium causes positive ions, more positive ions externally in the lumen, which causes magnesium and calcium moving to the interstitium of blood. As a result of inhibition of sodium potassium 2 chloride co-transporter, that occurs decrease in these as well as decrease in magnesium and calcium. Now, what are the examples of these loop diuretics? Examples are furosemide, torsemide, bumetanide and ethacrynic acid. What are the common side effects of these? These have side effects like hypertension, shock, cardiac arrhythmia, hearing damage and hyperuremia. Now let's move on to the next classification of drugs. The third is thiazide diuretics. What takes place in thiazide diuretics? What is the location of it? It is done in the early distal tube. What happens over here? Here there occurs increase in sodium chloride excretion. This is the main target of thiazide diuretics. Though 90% of sodium is reabsorbed in the previous parts, here this action takes place. To know more about it, let's zoom into the epithelial cells. Here is a sodium chloride exchanger where the extracellular sodium chloride enters into the interstitial cells and over here, epithelial cells, and over here the sodium potassium ATPase pump does it work as usually where sodium goes out and potassium enters in. Here is also an extra channel which is calcium channel, which takes the intercellular calcium which is present intercellularly to extracellular space, and sodium, and there is also a channel which transports sodium and calcium, inverse and inflex and efflex. Okay, what is this main function? The main function is to inhibit, where inhibition takes place over here in the sodium and chloride exchanger. Okay, this is the main target of thiazide diuretics. What is the pharmacokinetics and example side effects and indications? Example of these thiazide diuretics are chlorothiazide, hydrochlorothiazide, metolazone and indopamide. Now, what are the pharmacokinetics? Except chlorothiazide, other drugs are given orally. Only chlorothiazide is given in IV. Now, what are the common side effects of these drugs? These causes hypokalemia, GI disturbances and hyperuremia, increased in urination. Indications. In what cases these can be used? These can be used in cases like edema and diabetic insipidus. Now, let's move on to the next classification, which is potassium sparing drugs. What happens over here? Let's move on to the epithelial cells. Here, these action are classified into two groups, which is aldosterone antagonist and sodium channel blockers. Where aldosterone antagonist examples are spironolactone and eplerenone. Over here, sodium channel blockers are amiloride and triamterene. What happens over here? There are two channels, which is sodium and potassium channel, where sodium enters in and potassium comes out. First, when the sodium channel is inhibited, that causes potassium retention inside the cell, in which these two drugs does this work, which are amiloride and triamterene. And in case of aldosterone antagonist, which acts on the cell or in the epithelial cell, that causes increase in potassium. Okay, so these drugs are spironolactone and eplerenone. The side effects of these drugs, and sorry, I just forgot to inform you guys, the location of this is in the collecting tubule, and the main work of them is to decrease sodium reabsorption and decrease potassium excretion. So ultimately their target is done. As they increase the potassium level, the side effects are hyperkalemia, gynecomastia, which is enlargement of breast tissue in males, and menstrual irregularity in females. They have side effects of hyperkalemia, which means they can be indicated or given for patients with hypokalemia. Okay, now let's move on to osmotic diuretics. And these potassium sparing drugs can have a mild action or mild effect. So usually they are aided with some other drugs like thiazide diuretics. Now, osmotic diuretics. Osmotic diuretics, what is their function? Their function is to increase water excretion. The examples are mannitol and urea. These are not used in cases like edema. They don't have much effect in edema cases, as they have water excretion increased. And what are the indication cases? They have reduction of intracranial pressure, excretion of toxic substance in urine, and increase in urine in acute kidney disease patients. And side effects are electrolyte imbalance and dehydration. The pharmacokinetics are usually they are given intravenously. Thank you friends for watching this video. For more videos, stay tuned.
Medico videos, so it's very useful. So, try to subscribe and support us.